Southwest Washington. We have an office space in Kelso at 305 South Pacific. And we are a federally designated agency on aging for 5 Southwest Washington counties. We cover Cowlitz, Wahkiakum, Clark County, and Skamania. The agency is governed by a 5-member council of governments known as a COG. There's a county commissioner from each one of the counties that we cover. Cowlitz County is James Meisner. Clark County is David Madrow. Klickitat County is Rex Johnston. Skamania County is Chris Brong. And Wahkiakum County is Dan Cothran. Because we're a government agency, we receive direct funding from 4 different primary funding sources. So we get monies from the Federal Older Americans Act, known as the OAA, the State Senior Services Act, known as SCSA, the U.S. Department of Agriculture, known as USDA, and the Social Security Title 19. Title 19's Medicaid services. A lot of you know of them as DSHS or the COPES program or long-term care services. So it's our mission to promote independence, choice, well-being, and dignity for persons age 60 and over, adults with disabilities, and their families through a comprehensive, coordinated system of home and community-based services. Senior information is my job title. I'm an information and assistance specialist, and that's the main access point for all of the wide range of services for public and private resources in our community. We can provide those services by phone, in person, by email, or by regular mail. We have an open door policy. You're welcome to come to our office. Again, it's at 305 South Pacific in Kelso. What we do is we try to partner with community agencies that provide resources to the people in our community. So if you're looking for in-home care services, or you're just looking for a phone number to a local service, we have a database that we access when we get phone calls to give people that information. The community-based services that we work with is, again, the Senior Information and Assistance Program. So, are you guys familiar with 211? Has anybody heard of that? It's kind of like 911. When you dial that number, and you're looking for a resource, and they'll tell you what that resource is in your community. So what we did at one point in time is we contracted with them, and they provided us some of their resources from their database. And we took that data and we built on it. And so if you call our office and you're looking for a phone number for a local service, it's just a matter of me pulling up that information in my database, and then I can provide you with those resources. We provide case management for people who are on Medicaid long-term care services. So the Kelso office is a smaller office, but part of our staff carries a clientele that are on these services, and they go out and they provide home visits and make sure that they're receiving the services they're entitled to through this long-term care service. We're able to provide you with resources that can help you with in-home care services. We work often with different agencies in the area that provide these in-home care services. So if you contact us, we have created lists where we could mail you out like a listing, say, of multiple agencies that offer the same service with their name, their address, and their contact information. We do have nurses on staff, and they work directly with our Medicaid long-term care clients. So when our case management social workers go out and provide services to their clients, if they find that in their home they're needing some nursing skills, then they can have our nursing staff go out and visit them and make sure that they're getting the services they need. Maybe make some contact with the doctor or something of that sort. Senior nutrition. That's a big one in our community. There's a lot of people that aren't able to provide their own meals or get the things that they need to stay healthy. So there's the home delivered meals program through Lower Columbia CAP. I'm sure a lot of you are familiar with that. We can link people to that service. We can do referrals to get people on the home delivered meals program. We can provide you with the name, address, phone number, and contact for getting on those services yourself. We provide resources for senior transportation. There's a lot of people in this area that aren't aware of the amount of different senior transportation that's available. There's several agencies that provide transportation to and from doctor's appointments. Lower Columbia CAP, for instance, can provide you with 2 medical transportation per month to and from the doctor, and there's no charge for that.
You have to be on Medicaid to do that?
No. And that's kind of one of the reasons that our information and assistance staff is there is because there's a lot of questions involved around what is the eligibility, what are the qualifications. So if you call us, we've worked with these agencies long enough to know you're going to fit this program, but you're probably not going to fit that program, kind of deal. So it kind of helps you weed through the process of getting the service that's best fit for you. We can help with directly connecting and providing legal services and caregiver support. We have a great family caregiver support program. It's called the FCSP program, and that stands for Family Caregiver Support Program. We do a lot of educational events where right now we have an event going on called Powerful Tools for Caregivers, and we provide that 3 times a year. It's a class that supports the family caregiver, and the only requirement you have to go to these classes is to simply be providing care to a loved one. It doesn't matter who that loved one is. So when you go to these classes, it's a 6-week class. You go 1 day a week for 2.5 to 3 hours. And it's kind of a roundtable session where they will provide you with information that's going to help you dealing with the specifics of each individual situation that you deal with as that caregiver. We have another one going right now, and it's dealing with chronic disease. And it's an educational class where you can go and get information about specific diseases and how to maintain your life and health with that specific disease. Ultimately, the Information and Assistance Agency and Aging and Disabilities, we act as advocates for older persons, adults with disabilities, and family caregivers at a federal, state, and local levels. Information, referral, assistance, and case management services are all free to the consumer. So when you contact our office, whether you call us on the phone or you come over to the office and you're looking for a resource, there's not going to be any fees attached to that. We can help you in any way that we will try to help you in any way that we can to make sure that you're aware of what's out there and available to you to get you connected to meet your service needs. We do have a couple more programs like that are part of our family caregiver support program that may have a fee to them, but it just depends on what your financial situation is and what your specific needs are. I've attached a list of some of the wide range of resources that we work with. The majority of our calls are in relation to caregiving resources, support groups, home and health care, medical and dental referrals, Medicare and prescription assistance. We have a lot of people in this community that aren't aware that they qualify for a prescription assistance program or a premium assistance program, or that there's services out there that can look at what health insurance plan you have and find a more comparable plan for you, something that's more cost effective for you. We work really closely with Sheba, and they're part of CAP, and they have a lot of volunteers that work one-on-one with people, can sit down, look at your insurance plan, do a comparison, and show you exactly what you're paying versus what is available to you at other costs. So it's a really great service. I myself work with a prescription assistance program. It's actually a website, and anybody can access it. But what we do is we go to the website and we pull up the specific name of the medication, and it's going to connect us to an organization that provides assistance for that medication. So sometimes we can get people their medications for free at a 90-day supply. Sometimes we can get their prescriptions maybe a 90-day supply for $20. So each medication is differently and each plan's a little bit different.
This is if they don't have any insurance themselves and they don't know how to do it, or?
Each program has a different eligibility, and so depends on what the medication is. So if you come to me with a specific medication, I can look it up for you and I can tell you what the eligibility criteria is. Sometimes it'll say you need to be within 200% of the federal poverty level. So there's even a little key there where I can type in what your income is and it'll tell me what you are at the federal poverty level. So it's just a quicker, easier resource to try and link people to. We work with nutrition programs, like I said, the home delivered meals program. And there's congregate meal sites available in our community through CAP. People can go there and have a free lunch, or they can pay a donation of $5, $3 to $5, I believe it is. We have listings for housing options. A lot of people are low income and they're not able to afford the cost of rent nowadays. So there are some subsidized housing resources in our community, and we can provide them with a listing of that. I personally work with a kinship care program, and this is a very interesting program because it's a little bit different than what we do in my everyday job. But it's a program that offers financial assistance to family members caring for any other family member's child. So say, for instance, grandma and grandpa have a child, for one reason or another, is not able to take care of their child. And so the child ends up in your custody. So you're providing care to this child. Then you could contact our agency and we may be able to provide you with some temporary funding to help you get this child established in your home. We've helped with automobile repairs, we've helped with clothing, groceries, the list just goes on and on. But it's not specific to grandparents, it's aunts, uncles, nieces, nephews, brother, sister. As long as they're blood related and the custodial parent is not residing in the home, and there's not an open case with Child and Protective Services, then we should be able to provide them with a service.
May I ask a question then?
Sure.
Where do you get your money, from the state then?
No, as I stated earlier in the thing, or I'm sorry, in the thing.
Oh, back here.
We have 4 different sources of funding that come to us. I'm trying to find my sheets. They're in the packet that I gave you.
Okay.
Fourth page.
Are you seeing it? Is it the 4th page?
Yeah, I think so. From the front, 1, 2. It's the 3rd.
It's our primary funding sources are the Federal Older Americans Act, the State Senior Citizen Services Act, the United States Department of Agriculture, and the Social Security Act Title 19.
It's all government.
Yeah, it's all government.
Okay, it's the taxpayer.
Pretty much, yes.
That's what I wanted to get out. Who pays for all this?
Exactly. We are definitely a government agency.
We do.
Yeah. So,
And the meals for a cap, at the cap sites, is $2.50.
it is $2.50? Okay. I wasn't sure the exact amount, but that's good to know. Thank you. We can link you to activities and services that are available in the community, like what's going on at the local senior center. If you're looking for a specific interest or an activity, just give us a call and we can look into that for you and provide you with those resources. again, transportation is huge in this community. So we're always getting calls from people who are looking for transportation services, either to and from the doctor or to town to go shopping, or maybe is there somebody who can help me get groceries? I was hospitalized and I'm not able to get to the store. So we get a lot of those calls. We work really closely with Adult Protective Services. So we deal with a lot of vulnerable situations where we'll get a call from a neighbor saying, you know, my neighbor's just not coming out of her home, or he's not doing the things that he would normally do. I'm a little concerned about them. We would do our best to contact that person and try and find out if there is another service that we can connect them to, or maybe we could go out to their home and do a well check, or we could send a police officer out to do a well check. Maybe we'll find that the person's not in good health, or maybe they suffer with some dementia or Alzheimer's. And so we would try and make sure that whatever their services needs are, we get them connected so they get the help they need. And basically, any other service need or request that you have, if you call into our office, we're not going to turn you away. We're going to try and find a service that meets your needs. And if we don't have that service, we're going to try and refer you on to somebody who can. The last page I brought is a listing of how to contact us. The Kelso office covers Cowlitz and Wahkiakum County, and you'll see that I've included the local phone number as well as the 1-800 number for each one of the counties that we cover. So another thing I wanted to add is we get a lot of people who are here temporarily providing a care to a loved one and they live out of town. There are area agency on agings nationwide. So maybe you know of somebody who needs help, but they don't live here. You want to contact us, we can tell you what area agency and aging service is available in their community as well. So does anybody have any questions? There's several different programs available through CAP. The primary transportation service that we refer to, or most often refer to, is the medical transportation. And that's a service that is provided 2 medical appointments a month for free. They will go out to the home, pick the person up, and take them to their appointment and bring them back. There is other transportation
I heard
services.
something about $5 a month and then you could schedule, is that true? I mean, I don't know anything about this. I was trying to get her to do it because she's so stuck up, you know.
Does she have a disability? Is she mobile?
Yeah.
So she can walk and do all those things. She may want to go to her primary physician, and if he's willing to fill out a paratransit application for her, then she could apply through, it used to be Cubs, the local city bus. They have a smaller paratransit bus that's now called River City Lifts and River City Transport. But they used to, or I'm sorry, I got mixed up there. They can fill out an application for paratransit. She has a section that she would fill out and then the doctor would fill out. The doctor agrees that she needs paratransportation, then the transit bus would go straight to her home, pick her up, and bring her to wherever she needed to go. There's other agencies in town like Cowlitz Tribal. Each one of these transportation services has their own eligibility. So you would have to call specifically and ask questions. But I know that they do transportation. I have clients who live in Lexington and they'll go out there, pick them up, bring them to town for those kinds of needs, and bring them back home. So it just depends on, but if you want to contact our office, I can give you a listing of all the different transportation services.
Her, you know, because she's just stuck out there.
Yeah.
Paratransit does not stand and wait for you though. They will come back, you tell them, come back and pick me up in an hour, and then they'll be back in an hour or whatever.
Yeah.
Right. They
Very, very when they come.
Yeah.
But a lot of people use that.
Yeah.
I just thought she could do it, because I know she has a car, but it's like 40 cars.
Do you know if
afraid to
she's
take it
on-
anywhere. Her brother will drive it, but it's all,
Yeah. Do you know if she's on any state services like Medicaid, healthcare, or anything like that? Because Medicaid does offer a large amount of transportation services as well. So that's where we kind of come in, where we can kind of weed out what would be
so
most
this is
suitable.
just for, most of those things are for people that are Medicaid. not.
No.
No, there's several different programs, and each program has their own eligibility. And so I've just talked to you about 3 different programs. And so it gets very convoluted. So you have the actual piece of paper that shows you which agency offers what. It might make it a little bit easier for you. There is a transportation service that will go all the way to Portland. And that's through Lower Columbia Cap. They do provide transportation for that. And then if a person's on Medicaid, which is a DSHS program, and they have a Services One or a Provider One medical card, then there's Medicaid transportation available to them for that service as well. Okay, you guys, well, thank you for having me, and hopefully you'll give us a call and we can provide you some help. Take care.
What I got out of the program was that there are agencies or facilities that people don't even know nothing about, you know. So by getting a phone number and an address, if you don't understand something, give them a call. I hope you guys got a good lecture on this here, and use it. I mean, that's what it's there for, to help us out. As long as the government will still fund these agencies to take care of us, use it. The story, I got a story I want to tell. A neighbor of mine, she was in her 80s, something like that, and her niece thought she should have one of these medical alert buttons, and so she bought her one and give it to her. Actually, this woman was 97 years old, and so one day her niece come to the house to visit her, and she was laying on the floor there, and she was, Auntie, she said, "What? Why didn't you use your medical alert button?" She said, "Oh, that's for old people." So we have to get this out of our head that we're still young, and if we need help, it's here. It might not cover everything you want, but it's worth checking into.
Thank you.
And again, I want to thank you all for showing up today, and if there's anybody here that would like to have a one-on-one talk with Chris, she'd be willing to sit down and talk with you, I think. She already took care of Larry. That was a big chore right there. Okay, that concludes our program then. So what we can do now is, there's some dessert still left. There's still stuff in the kitchen there. And like all the Norwegians said, you don't go home hungry around here. There's always food. So if we run out of the kitchen, we'll find something out of the freezer or something. Dolly's been real faithful to us. A good woman to take care of that part.
Hey, let's give Dolly a hand.
Let's give Dolly and a big thank you for setting this all up.